Time now, 9:14. Our focus turns to babies as we explore heart-related issues for National Heart Month. Congenital heart defects are the most common birth defects. Dr. Frank Pigula is the chief of Pediatric Cardiothoracic Surgery at Children's Hospital in New Orleans, and he joins us now to talk about the challenges for doctors, parents, and their young children. Good morning, doctor. How are you doing?
I'm great. Thank you. Good morning.
Yeah, thanks for joining us. So we were just talking about congenital heart defects there in the break. I mean, there's certainly some things people should know about them if they're not familiar. I mean, this is something that you see beginning right in children.
Absolutely. And what I think a lot of people don't recognize is that congenital heart disease is a common form of birth defect. Between 1% and 2% of babies born will have some form of defect, some very minor, some very severe. Some so severe they require surgery within the first few days to weeks of life. But it is a very common defect, and in fact, as we were also mentioning, over the years, we've become successful in treating that to the degree that now there are more adults living with congenital heart disease than there are children.
And that's something that you told me is really more or less good news, because that means people are surviving.
It's great news. It means that we've developed the field over the last few decades where we've taken very severe forms of defects that had a 5% survival over a month, and some those survivals are now 80% over a month. So there's been tremendous progress. There's still a lot of work to be done, but we've also discovered that as those children survive, they get older, reach adulthood, they develop other problems that need to be managed in a specialized way, and that's become the field of adults with a congenital heart disease. As I mentioned, that's the fastest growing population we have.
Right. Okay. So, and this is these are diseases that can be managed as you go on throughout life. You were telling me that many people, as they grow older, if it's managed properly, they can live full, almost regular, productive lives.
Yeah, that's absolutely right. There are very, very few things that we actually cure. There are some, but many of these things require surveillance, management, and further care. But with that, people can lead full productive lives with active lifestyles, and it becomes more of a management issue rather than a real debilitation.
So what can be done? This isn't something necessarily where you have to don't do these certain things while you're pregnant to prevent this. This is something that just happens. Am I wrong in assuming that?
Yes, you're not. No, you're not wrong. It does happen. We understand why many of these things happen. There are some that are related to syndromic problems or syndromes that can be diagnosed in utero, but we don't understand most of them or what causes them. It is clear, though, if a mother has a baby with congenital heart disease, she has a higher risk of having another baby with congenital heart disease. But that risk may go from 1% to 2% to 3% to 4%. So it's still low, but my recommendation would be that if you have a baby with congenital heart disease, that you have fetal echocardiography on future pregnancies. And that's a process by which they can diagnose very, very well if the fetus has congenital heart disease before they're born. That helps us a lot when the baby's born and how to manage it.
So overall, I mean, this is something that people should just be aware of as you all continue to research and learn more on how to treat it and help people live long lives into adulthood.
Absolutely, and you'll find if you ask around, you'll know somebody who has a child or know somebody who has a child with congenital heart disease. And in this day and age with social media, these parents are kind of coming together and coalescing and forming support groups and information groups. So people are becoming very well educated and finding out that it's really a pretty common problem.
All right. Well, thank you so much for joining us this morning. We certainly appreciate it.